Welcome to TMI, a podcast by Henry Ford Jackson Hospital. Today, we have another new show. Very new. And Tim is here with us today.
Good morning, Dave.
Good morning. We're just a couple of dads sitting here in the podcasting studio today. And we got some cool stuff to talk about.
We're talking all things babies.
Babies.
No,
Yeah.
Dave and I haven't had babies ourselves. We have little ones.
We have little ones. But
So we've gone through that process with our moms.
We're fathers.
We're fathers. Yes, we are. And I know in the news lately, too, we've been seeing a lot of like baby formula shortage that's going on in the country.
That isn't wild.
It brings up some very good questions, I guess, for us, too. So, and thankfully, we have a couple of experts here with us in the studio.
We do.
Joining us today, we have Tish Hill, our Nursing Director for Women and Children's Services, and Dr. Ronald Nichols, OBGYN. He's the Department Chair and Clinical Service Chief here at Henry Ford Jackson Hospital. Welcome.
Welcome.
Thank you.
So we'll start with the good news. I mentioned the baby formula. We'll get there eventually, but more recently, Henry Ford Jackson Hospital was just awarded or just received an award from Newsweek. I guess can we kind of talk to that for our maternity award?
Yes, so we are very excited to receive this recognition and honored. Newsweek recognizes hospitals for excellence. So they're looking at criteria related to quality metrics, customer satisfaction, referrals, and what our staff and our providers are saying about our hospital. So we were amongst 350 hospitals throughout the United States, also Henry Ford Hospital in Detroit, that received this recognition from Newsweek.
Yeah, and so I guess I can mention some of the criteria, but what makes us stand out, I guess, some of our care that we provide at our hospital?
Well, we have an outstanding team at Henry Ford Jackson that comprises of nurses, lactation consultants, physicians, social workers. We have nutritionists, and we provide we have the MA staff, and we all work together to try to create a great environment for our pregnant mothers, and we want them to have their best experience when they deliver their babies.
Mm-hmm. And what's fun is we're kind of like promoting our mother-baby area quite a bit lately, and Tish was just involved in a video that should be out by the time this podcast comes out, all about the different things. So if you want to check it out and see the locations and some of the nurses and learn a little bit, that video is a great overview.
Yeah, we did some renovations too, right? To make sure it was more comforting for the moms coming in and everything. So yeah, that's been great. So, having a baby, going to the hospital, it sounds like we got that down, which is awesome. But that's just, one little part, I guess, of having a child. There's the beforehand, the prenatal care and postnatal care. So how are we taking care of moms, I guess, at Henry Ford Jackson Hospital with some of those pieces?
Well, ideally, we want to have and see patients who are planning pregnancy before they get pregnant. We think that's the best way to really ensure the best outcome. Mm-hmm. That means that if you have some medical conditions that you have, we would advocate and recommend that we get those under control before you decide or embark upon a pregnancy. So that's if you have heart disease or thyroid disease, for instance, we want to make sure you're there. Or if you have medicines that might not be compatible with a safe pregnancy, we can switch you to maybe a safer medication at that time. Okay. There's some lifestyle behaviors that also we would want you to kind of consider if you were doing that. That's smoking, to quit that. If it's alcohol or drugs, this is an opportunity to kind of work with patients prior to them getting pregnant to get in that sort of thing. Also, we want to make sure that they are on a special vitamin, folate, which is a vitamin B, but that also, if you take that at least 400 milligrams a day before and during pregnancy, it can help prevent some of the brain and spine birth defects that could impact the pregnancy. So those are some of the things that we also have some vaccinations. I know that's that's a hot topic, but there's some vaccinations that we would want you to have before you're pregnant. There's some that you can have while you're pregnant that protect the baby, and some that we would delay till after that. And so those are the things that we think would really assist the couple as they contemplate the wonderful world of parenthood.
Yeah, and I know, for being a dad and being with our first child, I was like, okay, there's vitamins. That's the only thing in my head I would think about. Obviously my wife had more thoughts in her head, thankfully, and took care of things. And we, I don't want to say she was older, but I guess maybe she was a little bit older. That's a consideration as well if you're going
and weight.
And weight, okay.
So some patients understand that they're going to be put on weight when they're pregnant, so they might have an opportunity before, particularly if they plan it, to maybe lose or get to their ideal body weight before they become pregnant. I know that Ms. Hill also had some things that she wanted to add.
I just wanted to emphasize that we do have free prenatal education classes that we offer to all of our patients, and then just put an emphasis on prenatal care. So if you're past the pre-planning and you've just found out you're pregnant, it's really, really important for you to seek prenatal care, and that's adequate prenatal care. And also consider attending our free perinatal classes, which are part of our Stork Club education.
Okay.
Yeah, we did that, and it was fun actually. Like, you got to do mindfulness stuff and also just learn a whole bunch. It wasn't I think it was once a week when I did it, and it was such a good experience to have that time with your wife or the person that you're going through this process with, and really just sharing that experience.
So now we're actually offering WebEx, and
cool.
We're going back to offering a few in-person classes, and then some tours.
Oh, really?
Yes.
Nice.
Yeah. Awesome. And I know you mentioned having adequate prenatal care, and I think that kind of speaks to what Dr. Nichols is talking about. Going in, what do we consider adequate? How many times should you be seeing your doctor? How often is that? If somebody's never had a child, or like you said, they maybe didn't plan it. What does adequate mean, or what do we think is for the best outcome for the baby?
So we the adequate is at least 7 visits, but in the beginning, we see patients about once a month, every 4 weeks, till up to about 28 weeks. At 28 weeks, you're entering your 3rd trimester, and we'll see the patient for about every 2 weeks. That's twice a month till they get to 36 weeks, and then we see them once a week until they are delivered. So you can see with that, they're going to have at least 7 visits. But 7 is what we would think is the minimum amount of visits we can have. But we sometimes, for circumstances out of their control, we don't get to see patients as early as we would like, because the earlier we see them, the better it is to date their pregnancy, to be able to kind of anticipate some of the issues they might have, we get a chance to go over their family history, because a lot of times what Aunt Sue or Uncle James had might impact your pregnancy. So we want to be able to ask you those things. And so if we have to make any interventions, we have an opportunity to do that.
I guess we can kind of skip ahead on a couple questions here, but what are some of those challenges that the patients are facing, or that women are facing in our community that you're seeing?
So some of them, we see that we're talking about insurance. So without adequate insurance, sometimes it's very difficult. They do have some free classes and some prenatal stuff, but we're looking at to try to make it consistent for that. We have some patients that have transportation challenges. They can't, those are barriers for people who don't have transportation. So the public transportation might not go where they want, or might not be timely. We have some patients that have to decide between work and coming in for prenatal stuff, because they don't have the type of prenatal access or leave that they can get because of where their job is, and won't allow them to do that. And we also have some patients that work in very hazardous conditions that and don't have options to go other places. So those are some of the challenges that we see with patients that come. And for the patients that have had previous children, it's very difficult to get someone to babysit, or childcare, is very expensive. And sometimes offices aren't conducive to bring 2 or 3 kids with you for your prenatal visit.
Yeah.
So those are some of the things that are challenges for our patients in our community, and perhaps in other communities too.
And I mean, overcoming some of those challenges, I mean, ultimately it's for having a healthy baby, right? I mean, that's the point, is so the mother has a healthy baby and a good start, but that's not always the case because of some of those challenges, right?
For every dollar in prenatal care that we spend, we save about $3 in postnatal or curative care. So it's really cost effective to do that. And we found out that about 60% of the tax dollars that we're spending are for those types of curative cases after. So that even if you're not interested in prenatal care and stuff, that it's in your best interest, because your tax dollars will be spent a little bit more efficiently if we can get folks into prenatal care and early and consistent prenatal care.
It's kind of that saying that whole ounce of prevention is worth
Absolutely.
a pound of cure. So, but there is, even like in our community and other communities as well, there's some differences in how mothers are cared for. You mentioned some of those challenges, and we have those in Jackson, in our county, in our city, where there is some differences for mothers and for babies, right?
Yes, so there are some significant and alarming disparities, racial disparities, when we're comparing Black babies to white babies. And unfortunately for Jackson County, the infant mortality rate has increased again from 2020 to 2021. Also, we look at the miscarriage rate of moms. So there's losses experienced before the babies are born and then after, considering the infant mortality.
With miscarriages, I kind of stop you real quick. I guess, how is that measured, I guess, or in a way? And the only reason I ask that, because I know some moms, probably it's a difficult time to deal with that, and they don't really want to talk to anybody about that. Sometimes they will, because they don't know what's going on if they're a new mom. I guess, how do we find out? And I guess the only reason I ask is to also encourage people that it happens a lot more often probably than we think.
Yep. So we found out from, providers' offices, from having confirmed established pregnancies, some of these miscarriages are occurring in the emergency department. So we have that information. And then also we're experiencing some within our own unit.
Yeah.
But we do have a great perinatal bereavement coordinator that can help with resources. And she's very wonderful, Joy Starrett, to any patient that experiences a miscarriage or infant loss.
And I think hopefully I'm not out of place talking about this, because my wife and I were going to have our first child. We lost our first one. And so we had to go through that. And we didn't know about the perinatal bereavement, but obviously it was a difficult time. But we have two little ones too that are healthy, which I guess is the bright side of that, is saying, we also have two children, 6 and 8 now, that, happy and healthy, and everything went well with them. So I just point that out, because I know there's a lot more loss than I think most people are aware of in our community as far as miscarriages. But there's also a lot of, you talked about infant mortality. Like, I don't think people realize how much of a difference, or what the disparity is in how many children kind of we're looking at or talking about.
Yeah, so the latest statistics for Jackson showed that Black babies were 4 times more likely to die in Jackson County.
So in my head too, and I know you've been doing work on this, what do we do? How do we try and affect that? Because I would imagine most people, anybody, you don't want to see babies dying. Like, that's not, like, we want to raise happy, healthy kids everywhere for everyone. How do we work on that? It's a big question.
Well, so we're going to circle back to prenatal care early and often to get prenatal care, because a fair number are going to be, if we can have an impact with prenatal care on preterm births. Preterm births are going to be our challenge, and if we can make an impact on that, we can certainly make a dent in that. We also want to, early and often prenatal care, we can look for signs and symptoms of high blood pressure or preeclampsia and those sort of things where we have that. And finally, we're also looking at safe sleep initiatives where babies are and mothers, I said, and couples are taught how the baby should sleep on the back, and there should not be soft pillows or stuffed toys around them. Those types of things are always going to make a difference.
Yeah.
So I want to add what the hospital was actually doing for to hopefully combat and decrease these disparities in the infant mortality, maternal and infant mortality rates. So Henry Ford Health actually does have a Diversity, Equity, and Inclusion Justice Committee. And their strategic outcomes is to reduce maternal and infant mortality and morbidity rates in the communities of Jackson and the Detroit area. We also were required, all of the staff and providers were required to attend mandatory implicit bias training. So that has also been shown to be a reason that patients may not receive adequate prenatal care. There may be barriers or not feeling respected or having a good relationship with their providers. And our hospital also just joined a National Perinatal Improvement Collaborative. This Perinatal Improvement Collaborative is called Premier. And what they do is they compare the evidence-based practice. They come in, they look at our practice, our outcomes, our policies, and they develop a roadmap for our success. So based on national statistics and best practice, they look at what we're doing and then help us to align with how we can improve.
So with that, I guess you mentioned the interactions they would have with the healthcare provider. How would you encourage, or how can healthcare providers, talk with patients that are pregnant, besides just obviously going to their OBG? There's other healthcare people that they may run into or during this time frame. I guess how can they help with some of that, or what encouragement? Is there anything you can say to that, I guess?
Yeah, well, so we want to encourage patients who need the services of a mental health professional. Some patients have some mental health challenges, and we want to make sure that they're plugged into that.
Yeah.
We also talked about how the opioid use disorder is something that has really been prominent in not just our community, but throughout. So we have partnered with Lifeways and some of the other services that are in Jackson County to assist patients who are struggling with that challenge. We have social workers, licensed social workers that can help folks who need stuff and who might need or WIC appointments or those types of services to assist them in that. So when we started out, we said there was a team, and there is a team, and we try to utilize all that. We have the lactation consultants who provide the breastfeeding support that patients vitally need, particularly our young mothers. And we want to make sure that we give support even after they deliver, so that after they deliver, the support doesn't just drop off, that they continue to get support.
Yeah. And you mentioned breastfeeding, and I know when we had our little ones, there was a challenge on that. And especially right now, if mothers can't breastfeed, there's a challenge as well. I mean, so that it's a very important, support after the fact is a big part of that as well.
Absolutely.
So,
great. So is there a place where people can find out more information about this? I'm sure we'll put it in the description of the podcast and everything. But where people can get connected if they need prenatal or postnatal care or anything?
Yes, so they can call our Stork Club.
Okay.
I don't know the number here.
Okay. Just say that and we'll put it in there.
I'm sorry, I don't know the number by heart. And that they can schedule them for a tour, for prenatal classes. They could contact our lactation consultants. So our lactation consultants also provide free outpatient lactation visits as well. So if they're at home or they're still struggling or having some issues or questions, then they can call our lactation consultants at the hospital.
Great. Yeah, we'll make sure to put all that in the description and let everybody know about that.
Yeah, there's a lot of services around pregnant mothers. I mean, and that's the thing we want to talk about. It's a community that helps these mothers and a community to help to raise the children. And we have a lot of resources that we can offer that we want to make sure people are connected to have the best outcomes and have, healthy babies here in Jackson County. Absolutely. And give them the best start they can. So,
absolutely.
Thank you again, Dr. Nichols, Tish. Thank you for coming in and talking to us about prenatal, postnatal care. We appreciate it.
Thank you guys for sharing the story. It's very important.
And thank you for inviting me. Yes.
All right. If you'd like to listen to more of these podcasts, you can find them on iTunes and Spotify and on the Henry Ford website at henryford.com/podcast. And we got another one of these coming up real soon. And Tim, I know after having a child, you need this next podcast. It's going to be a mindfulness one where we can be centered and kind of recover from all the craziness.
That goes on after the postnatal care, right? That mindfulness, that Zen space. Yeah.
Yeah. So thanks for listening, and we'll be back soon.